1 in 10 people get acid reflux almost every day, and if that includes you, I'm going to give you some great tips that should really help. Now let's begin. Okay, so first let me explain to you acid reflux and heartburn, but bear with me a couple of seconds because I've thought of a really creative way to explain it to you. So here's my masterpiece. Obviously it's not to scale, but you have to use your imagination a bit. The glass part is your esophagus, the green balloon is your stomach, and the black tape is your lower sphincter. Now the lower sphincter is a muscular valve which lets food in one way. So food and liquid come down into your stomach one way through this. Now here's the fun bit. The lower sphincter closes and prevents food from the stomach and stomach acid from refluxing back into the esophagus. But if it opens too far or doesn't close tight enough, then this stomach acid can reflux back up like so. So this is what leads to acid reflux or gastroesophageal reflux disease, otherwise known as GORD for short, which is the more chronic, severe version of acid reflux. And they both cause that burning sensation in the chest, which everyone calls heartburn. So heartburn is a symptom of acid reflux and GORD, and I hope that helps clear things up. And one last thing, the other symptoms of acid reflux include an acid taste in your mouth, wind, belching, bloating, and possibly a dry persistent cough. Now let's move on to tips. So, remember the esophageal sphincter? Well, there are ways to make this stronger and prevent acid reflux. Smoking, drinking alcohol, and being overweight. All factors that can reduce the sphincter strength. So if any of these apply to you, then consider stopping smoking, reducing or stopping your alcohol intake entirely, and getting to a healthy weight. These can help strengthen the esophageal sphincter and make it close tighter to prevent the acid reflux and its symptoms. Some medication may also make your symptoms worse by either irritating the esophagus or relaxing the lower esophageal sphincter. Now the most common culprits are anti-inflammatory painkillers like ibuprofen and aspirin, and also other medication like diazepam, theophylline, and calcium channel blockers like nifedipine. And by the way, that wasn't a complete list because we'll be here forever. Instead, if you feel like a medication is causing you symptoms or increasing your symptoms, then speak to your pharmacist, they'll check for you and advise you appropriately. So let's say your acid reflux symptoms are worse at night when you're lying down in your bed. And that makes sense because the acid is no longer fighting gravity to make its way up your esophagus. You're now lying down and it can easily make its way up. So the solution to this is to elevate the entire upper part of the body. So that doesn't mean get a big pillow and put it behind your head, because that's just going to elevate your head and make no difference. So what you want to do is raise one end of the bed by about 10 to 20 centimeters. So either put something under the top two legs of your bed or under the mattress, or even use a wedge. So the chest and the head are above the waist and the acid isn't going to travel up like I showed you before. In addition to this, going to bed with an empty and dry stomach can also really help. So in the last 3 hours of going to bed, make sure you don't eat anything, and in the last 2 hours of going to bed, make sure you don't drink anything. With foods and drinks, the best advice is to eat smaller, more frequent meals. Peppermint, tomatoes, chocolate and caffeine are all suspected of making acid reflux worse. Now for more information on this, I've left a really useful link in the description below to an acid reflux diet sheet, so feel free to check it out. Also, if you like to wear tight clothes around the waist or a belt, it's going to push up that acid and cause the acid reflux symptoms, and nobody wants that. So instead, try and wear something loose. For treatment of acid reflux, I'd always recommend patients to speak to their pharmacist first. They can then ask you specific questions to determine whether they can give you treatment over the counter or to refer you on to your GP. And in terms of treatments, there's loads of options that pharmacists can recommend, from antacids, alginates, and acid suppression tablets, but this will be determined on an individual patient basis. Lastly, acid reflux isn't usually serious unless you have red flags, and that means you need to see a GP urgently for treatment and investigation. Now there's quite a lot of red flags, so I've left them in the description below, and I would strongly advise everyone to read them. And that's it! You're now an acid reflux pro. I hope you find my tips useful, and if you know anyone who'd benefit from my video, please help spread the knowledge. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos. I should have been an engineer. This is like some real amazing engineering from Abraham the pharmacist. Abraham the engineer? No? A non-antihistaminic. Do you know that drug? Really good drug. Gastroesophageal. This is how difficult it is to film in a pharmacy. See, if only you knew the pain I have to go through. I've got Nadia labeling. I've got Lewis, the loudest dispenser. Literally, if there was an award for the loudest dispenser, I think he'd win it.